King's College in Georgetown. He did his master's degree program and he graduated in 1969, did an internship in Guyana in 1969 to 1970, followed by private practice in January 1972. He worked in several areas, Lucy, Hanover, Mandeville, Manchester, and Kingston, and joined the Lions Club of Mandeville in 1975 as a charter member, and served as president since 1978 to 1979. He transferred to the Lions Club of St. Andrew in 1990 and has been a member since. He is also a member of the Diabetic Association of Jamaica and has been so since 1990. Due to strong family history of diabetes, he was blessed with the opportunity of experience of diabetes type 2 between 2011 and 2015. And it is said here that Dr. Haim literally healed himself, and we're interested to know how he actually did that. So we look forward to hearing from him as our third presenter. And I thank you so much for listening to me and listening to those brief profiles. I want to now ask Dr. Alvyston Bailey to present to us and tell us all about diabetes and the management of it. And it is said that approximately $2 or $3 trillion is spent on diabetic medication yearly. Whether or not these figures are true, I don't know. But if we can find a way to reduce the intake of medicines for this dreaded disease, we'd certainly love to find it. So we're going to ask Dr. Alvyston Bailey to guide us through this process and leave us here this evening feeling much better about ourselves, our family, and friends who are inflicted with this dreaded disease. Dr. Alvyston Bailey, the floor is yours, sir.
Thank you very much, Dr. McGregor. It's really a pleasure to be with you and your colleagues this evening. And I must tell you, you might not know this, but you helped me to fine-tune my broadcasting skills. So I'm very happy to be here and to present this brief discussion on a subject that is essentially close to my heart.
I'll send you the bill later on.
You're welcome. Now, I'm going to give you an overview of diabetes worldwide. Then I'm going to zoom in on some interesting slides which will put things in perspective in terms of the reality of non-communicable diseases in Jamaica. And then I will discuss the classification of diabetes. Then I'll look at some risk factors. I will not spend a long time looking at treatment because that is essentially in the domain of those who have failed to prevent diabetes. But I'll spend some time looking at the primary reason for us being here today. What can we do to prevent and control this most unfortunate condition? Now, data from the IDF Atlas and edition reports a continued global increase in diabetes, and it is essentially a significant global challenge which impacts on health and well-being of all of us. Of interest, I want to go to this slide, which looks at what is described as the unrelenting march of diabetes. I thought this slide was quite interesting because it showed some fairly sobering fact in that in all the regions of the world, whether it is the Americas, the European Union, Western Pacific, Eastern Mediterranean, Africa, or Southeast Asia, diabetes continues to increase. The orange circle looks at the prevalence in 1980, and we move forward to 2014, we can see that it has gone up significantly, and I'll expand on that shortly. But if you look at the region of the Americas, we have moved from 18 million in 1980, when I left medical school, to 62 million in 2014. And I'm sure by now it has gone to over 70 billion. We'll discuss that shortly. In terms of the global costs, you can see that it is horribly expensive. For example, in North America and the Caribbean, we're looking at 348 billion in 2015, and by 2040, it will have arisen to roughly $390 billion to treat and control diabetes mellitus. Of interest too, if you look at the data again coming from IDF, in 2017, we're looking in the Americas here, North America and the Caribbean, 15.4% of the population have diabetes, and by 2045, it will rise to 16.7%. Now, again, the data from IDF shows that in 2017, 1 in 11 adults have diabetes, and in 2045, it will be 1 in 10. It also shows, quite interestingly, that there's a gender preference worldwide. This is different from our Jamaican experience in that worldwide, men apparently are more affected than women, but in our Jamaican situation, the converse is true, and I'll explain that to you shortly. So the most recent data then in 2021 is that 537 million adults are living with diabetes, 1 in 10, and it will rise to 784 million by 2045. Over 81% of adults with diabetes live in low and middle income countries, and that is a major challenge. I thought this data coming from IDF would be quite sobering to enable us to conceptualize the enormity of the problem that we face. And I'm sure you're not going to forget this because it's not forgettable. It says diabetes is responsible for 6.7 million deaths in 2021 so far, which is 1 every 5 seconds. That is 1 every 5 seconds. And of interest, 541 million adults have impaired glucose tolerance, which means they're pre-diabetics. And 51 million worldwide in the Caribbean are living with diabetes. And this is expected to reach 63 million by 2045. The other data that really is very worrisome is that 1 in 4 adults with diabetes are undiagnosed. And in North America and the Caribbean, 931,000 deaths are caused by diabetes as at now. And the cost in 2021 so far is $405 billion that has been spent on diabetes mellitus. Now I want us to pause to look at some Jamaican data because I went through these while I was preparing for this lecture and it left me quite disturbed. This was the Jamaica Health and Lifestyle Survey presented to the government in 2017. And they look essentially at the prevalence of obesity, diabetes mellitus, hypertension, high cholesterol, heart attack, and strokes. And it was a community-based intervention, and they actually interviewed 1,089 males and 1,718 females, and across the island. I thought this slide should be very interesting to guide us the way forward in terms of the discussion, because it looked at pre-obesity and obesity by age. Pre-obesity really means that you're heading towards it, and obesity have arrived. And what it showed is that there's a high prevalence of overweight in all age groups. The lowest was in the 15 to 24 age group. The highest was among those 35 to 44 and 45 to 54. And as one would expect, the lowest is in the older age group. Let's look at prevalence of obesity by sex. This is very worrisome. because the rectangles in red represent female and those in blue represent males. It showed across all age groups that women by far were exceedingly obese, were far more obese than men. And again, the highest level of obesity was between 35 to 64. This, you can predict what is going to happen with respect to obesity-related disease when we look at the next slides. I actually thought this slide was particularly interesting because I practice in Falmouth, Trelawney, and my practice in Water Square, right before the pier. And I've always wondered if I was getting a little visual hallucination because every other woman that I saw in Trelawney was either obese or overweight. And to my surprise, the data shows that Trelawney, ladies and gentlemen, have the highest prevalence of obesity. And I'm not surprised. The women in particular in Trelawney are very obese. And this substantiated. Now, when we look at the prevalence of obesity by males, well, it showed that St. Thomas men are fairly skinny. And those in Portland, you could work on why that is so. These are the farming communities. And I can't fathom why Hanover has so many fat men. It begs the question, but Hanover has a lot of obese men and Portland very few. Now, this slide is a key slide for you to look at to inform our discussion because it shows an exponential rise in diabetes mellitus with the passage of time. And that is worrisome. It means, therefore, we as members of the Diabetes Association Jamaica and our partners, which is Lions Club, are not achieving the objective that we really hope to achieve. We need to fine-tune our intervention skills to stop this from happening because it shows that kids have very little diabetes among themselves. But as the males and females get older and older, the prevalence of diabetes increased significantly, especially among women. And what bothers me really is that whereas women were far ahead of the men from 45 to 74, after 75, the men started to play catch up. That is worrisome. In terms of parishes, Trelawney isn't doing so badly. Manchester had the highest prevalence of diabetes, followed by Westmoreland. And again, Portland is low on the list, but I'm a little surprised at St. Tad, because St. Tad is a fairly wealthy parish. And Trelawney is not so wealthy. So the academics among us could start crunching the numbers to come up with some hypotheses. When we look at the prevalence of diabetes in parish by males, Trelawney was fairly low, and so was St. Mary. And Hanover, again, was fairly high. No, not really. Hanover was 19. Kingston, 17, and Clarendon, 19. But St. Mary and Trelawney and St. Thomas, low prevalence among men. This slide is interesting, and it is begging for some analysis because the data from Wilkes et al. Showed no differences between rural and urban residents. I find that interesting. I thought you folks in the urban area were overfed and were lacking in exercise, because I would have thought that rural folks would tend to be less well fed and tend to be more inclined to exercise, would have a lower prevalence, but the data didn't prove that. Now, with respect to those who are heading towards diabetes, it shows here that 10% of the men were heading towards diabetes. And this actually is what the Diabetes Association of Jamaica do on a regular basis. We screen persons to identify pre-diabetics. Women were greater than men, and it's statistically significant. And the data overall, when they crunch the numbers, suggested that 24% of persons 15 years or older were heading in the diabetic direction. They look at hypertension, and again, the women had a high prevalence of hypertension than men, and that is using the JNC guidelines, but it was marginally higher. When they use the American Heart Association guidelines, the prevalence for men and women were essentially the same. But of interest, colleagues, for both sexes, it was almost 60% of the population that was investigated. So what this shows, and I would like us to just pause for a while to let this data percolate through our minds, because I find it particularly worrisome, and it's something that we're going to have to do, we're going to have to deal with. The data showed that only 32% of Jamaican adults have normal blood pressure. Repeat that. Only 32% of Jamaican adults have normal blood pressure. And I shudder to think what is happening with the advent of COVID and the shutdowns and work from home and the high intake of fast food, what this figure will now be if it is done at the end of this year. With respect to hypertension by age, again, it's the same picture as diabetes. As the population age, the blood pressure levels rises. And again, colleagues, women were outstripping men. To me, it's statistically significant, but as both sexes age, the prevalence of hypertension grew significantly. Again, there were no difference between rural and urban residents. With respect to parish, for what it's worth, Westmoreland had the least hypertension. Yep. What's Trelawney doing? Trelawney was near to the top. The parish, strange but true, with the highest hypertension was St. Thomas. I can't understand why. I thought with all the stress and the poor eating habits of Kingstonians that they would have more hypertension than the rural folks. So St. Thomas and Hanover had the highest prevalence of hypertension. It begs the question as to what's going on. Perhaps they're more stressed out. High cholesterol. Well, again, colleagues, women are outstripping men with a prevalence of 19.7% in women and 15.8% in men. And the prevalence in rural folks was 20%. And among female, 23% rural, 17% urban. Again, something is not quite right here. It appears as if the lifestyle of the rural folks is predisposing them to obesity, to hypertension, and to diabetes. Again, with respect to cholesterol by age, the data is self-explanatory. Women are outstripping men, and as age, the cholesterol level gets higher and higher. I thought that this slide also would be an interesting one to share with you. It look at the correlation between obesity and hypertension and diabetes. And this is well documented worldwide. But when we look at the data from our own study, it's very sobering and self-explanatory. And this is a topic that I'm sure my colleague, Dr. Calendar, will spend some time to address, because it showed that when you are skinny, your hypertension level is fairly low, 22%. When you are obese, it goes up to 47%. Yeah, so skinny people are less likely to be hypertensive, and obese persons are far more likely. So this would be the overweight category, 40%, over 30, 47%. What about diabetes? Well, again, the data is self-explanatory. Skinny people are less likely to get diabetes. So in the data, those that were really thin, 5% prevalence. Those that were obese, 20% prevalence. The data speaks for itself. So when we're going to look at prevention and risk management, it's obvious that we need to use the data to guide us in terms of the way forward. This slide, colleagues, really bothered me because it shows the level of awareness for hypertension and diabetes. It shows that men were less aware of that they were hypertensive than women. Well, at least in this slide, the women are doing better than men. And this is self-explanatory because men tend not to take themselves too seriously and do not go get regular checkups. But males were more unaware of their hypertensive status than females. With respect to diabetes, again, men were more likely to be unaware than women. So that is a matter that we need to address. So we need to perhaps target our message for men, even though the women are still having some challenges. And this slide, and I'm going to wrap up this slide to get into the meat of the matter, but this will put things in sobering perspective. I don't like this slide at all. Do not like it because it shows that of the 63% of men on treatment, only 26 were controlled. Of the 73% of women on treatment, only 33 were controlled. For both sexes, therefore, 70.2% were on treatment and only 31% were controlled. We are failing to treat to target. It means that something is wrong. We are spending millions of dollars for treatment, but both men and women are not reaching target, and the men are worse than women. With respect to diabetes, 91% of men who had diabetes were on treatment, but a miserly 30% were controlled. The women were not doing much better. If we aggregate the numbers, 92.5% of both sexes were on treatment, but a mere 27.5% were controlled. We are not doing well. I'm not going to spend a lot of time this evening on complications because that will take many hours to discuss. But it means that all patients are heading in the wrong direction, and that explains the high level of morbidity or mortality that we are seeing both from hypertension and diabetes, because our patients are either not taking medication given, or they are not being given the medication that they should get, or they are having other challenges with respect to treatment. So with respect to heart attacks, well, this is understandable. Men get more heart attacks than women. So, but the prevalence of heart attack is fairly low, 4.2 per thousand. Stroke, with respect to stroke, men had more stroke than women. Again, that is understandable. This particular slide ends this part of the discussion. And I do not like the slide. And I want us to reflect on this slide very soberly. I do not like it because we look at data from 2001 to 2017, and I've given my team at the DHA the mandate to dig up a lot of data because the age is 45 years old. And tell us what's going on in terms of the screening that we have been doing since 1976. Because if we in fact could find that data, it would really be critical to understand what is going on. In 2001, the obese population was 45. In 2008, 52. In 2017, 54. 18% change, which that is pre-obese, which basically means overweight. With respect to obese, 20, 25, 29, a whopping 46% increase. Hypertension, 20.9, 25.2, 31.5. A significant 50.7 change. Now our pet subject, diabetes mellitus. A miserly 7.2 in 2001, which is when it has now gone up to 10.2 in 2017. And as today, colleagues, it is 11.9. So we are not doing well. When we look at the data, it means that we need to recognize that whatever intervention strategies we have put in place to deal with non-communicable disease is not working. With respect to high cholesterol, 14.6, 2001, 11.7, 2008, and 17.1 in 2017. It's going up. This is a serious jump of approximately 6% over 9 years. So those are my thoughts. Let me move into diabetes. I'm not going to go through these fairly quickly. You do not need to read the slide. I'll just take the points I put in bold are the key points. There are 4 types actually. We have type 1 diabetes due to the presence of antibodies that destroy the insulin producing cells. Type 2, which is essentially due to loss of insulin secretion or resistance. We have some minor types due to genetic disorders, disorders of the pancreas, and chemicals such as steroids can induce that particular problem. And then we have gestational diabetes, which essentially is diabetes seen in the 2nd or 3rd trimester of pregnancy. I want us to pause right here now because the ministry's mantra for Diabetes Month is to know your numbers. This is a matter that is creating complete confusion among healthcare providers and among patients. And it is unnecessary for this confusion to continue because we really only use 3 parameters to diagnose diabetes according to the experts. 1 is fasting plasma glucose, 2 our postprandial glucose, and 3 A1C. I cannot, for the life of me, understand why it is causing so much confusion. If you're fasting, which means basically that you have not eaten for the past 8 hours, plasma glucose is greater than 7, or your 2-hour glucose, which essentially means 2 hours after you've had a meal, or you have been given a glucose load. If your 2-hour glucose is greater than 200, or your hemoglobin A1C is greater than 6.5 on 2 or more occasions, then you have diabetes. That's it. Fasting, 7. 2-hour, 11.1. A1C, 6.5. That's diabetes. It's really not. So when we're treating to target, what we're hoping to achieve is to get the fasting below 7, to get your 2-hour below 11.1, around 10 would be nice, and get your A1C to about 6.5 to 7. That's it. So once we treat to target, those are the numbers we need to remember. Let me repeat. Fasting, 7. 2-hour, call it 11, 11.1, 11.2. A1C, 6.5. If it is greater and you satisfy the fasting and you satisfy the 2-hour, then we call that diabetes. It's kind of simple. And people tend to get very confused about this and are unaware of what is their target. So those are key points I want you to bear in mind. Now, I want to move on now to gestational diabetes, which is diabetes that is seen in pregnancy. And we recommend that you test for undiagnosed prediabetes at the first prenatal visit in those who are at risk for developing gestational diabetes. And these are usually women with a family history or very obese. So women with a history of gestational diabetes should have lifelong screening for the development of diabetes at least every 3 years. And if they have had gestational diabetes, they should be recommended to pursue intensive lifestyle intervention. And there's the new studies have shown, and this is a take-home point I want to share with you, that metformin can prevent diabetes. Now, what are the risk factors for diabetes? I'm just going to focus on this slide, which is self-explanatory. As you get older, you're more likely to get diabetes. The risk goes 5 to 6 times. If your body mass index is greater than 30 kilograms per meter squared, 4 to 5 times. If you're overweight, between 25 to less than 30, 2 to 3 times. If you're hypertensive, 2 to 3 times. If you have excessive lipids, 4 times. If you have 1 first-degree relative or 2 second-degree relatives, 3 times. If you have 2 first-degree relatives or 1 first-degree and 2 second-degree, 5 to 6 times. If you have a genetic flaw, which is heterozygous 1 parent, homozygous 2 parents, it goes up to 10 times. That's all you really need to know about risk factors. The slide I showed you is self-explanatory in that the higher your blood sugar level is, the more likely you are to have other risk factors like obesity and hypertension. I'm not going to spend much time on complications because that is a long story. And this is what should not happen. I always tell my patients that if anyone develops complications of diabetes in 2021, it is self-inflicted injury because we have good medications that can prevent complications, and this should not happen. And based on the data I showed you, 70% of our patients are not reaching target of 7 on the 11 or on the 6.5. Therefore, they are destined, guaranteed, assured to get complications. So what are the complications? We're not going to spend any time on this. They can end up with excessive acid and ketones in their body called ketoacidosis, type 1. You can get complete dehydration of the tissues resulting in coma, loss of fluid, called hyperosmolar coma, where there's excessive loss of fluid and your plasma will become thick, and you end up with a coma due to impaired circulation. And of course, you can get a drop in blood sugar called hypoglycemia. The chronic complications are many and varied. If you get narrowing of the large and medium-sized vessels, you face a great risk of myocardial infarction, loss of circulation to the leg called gangrene, and of course, hypertension due to stiffening and narrowing of the blood vessels. If the small blood vessels are affected by diabetes, it can affect the kidney, called nephropathy. It can affect the eyes, called retinopathy, resulting also in cataract and glaucoma. If it affects the nervous system in the peripheries, it's called neuropathy, and it affects the nervous system that regulates your unconscious activities like heartbeat and GI tract and breathing. and bladder function, which is called autonomic neuropathy. These colleagues should not have. I want to show you something though, to put things in perspective. And this slide of thought explains the issue very well. And those of us who, and I know Lions Club is one of the key partners in the Diabetes Association. We need help with respect to the dialysis unit. Our chairs are looking tattered and torn, not in keeping with the status of our association. And the machines are overworked. Let me repeat, our dialysis machines at DHA are overworked. Why is that so? Because based on this slide, the commonest complication of uncontrolled diabetes is chronic kidney disease, approximately 30%. This is preventable and totally unacceptable. And if you should go by DHA, our machines are running continuously from 6 o'clock in the morning up until late at night. Why? Because a significant number of our diabetic patients have developed chronic kidney disease, which is the most common complication. Mr. Bernard, who is our podiatrist, will tell you that he's overwhelmed with food problems, 22%. The ophthalmologist, challenge with dealing with eye problems, 19%. The ICU beds are filled with heart attacks, 10%. Chest pain and heart disease makes the cardiologist busy. Congestive heart failure, 8%, is in the domain of the internist. And of course, strokes, about which we oftentimes can't do anything, is about 7%. All these complications are unnecessary. It reminds me, colleagues, of my pet subject, which I'm not going to talk about tonight, which is COVID-19. I maintain that anyone who ends up in hospital now with severe illness or end up in ICU who is unvaccinated is an unnecessary morbidity, a totally unnecessary death. And the same thing applies to diabetes. We can prevent kidney disease, foot problems, eye problem, heart attacks, heart failure, stroke, if we just treat the targets. 7, 11.1, and 6.5. With respect to complication, please note, colleagues, the rectangles in orange. It shows that normal blood sugar levels basically is the way to go, because those persons who have normal blood sugar levels, very few heart attacks, very few chest pain, very few congestive cardiac, almost no strokes, very little kidney disease, limited foot problem, and no eye problem. Therefore, it means, let me repeat, that normal blood sugar levels will make you live to a ripe old age with minimum complications. I don't think any more slide can be compelling than this. There was no eye problem, very few heart attacks, limited heart failure, very few strokes, very few kidney disease, limited foot problem, and almost no eye damage. That is self-explanatory. So let those graphs remain embedded in your mind. So I'm going to end my discussion by looking at prevention. And the overall recommendation is that lifestyle change can prevent disease. And we recommend that patients should get involved in intensive lifestyle behavior change to maintain at least a 7% loss of body weight, that they increase moderate intense physical activity, such as brisk walking to at least 150 minutes per week, and they consult the nutritionist given a tailored meal plan to suit their own taste, lifestyle, and expectation. The latest news from ADA, and this is coming from the most recent guideline, is that, and those of you who are listening, you could write this down, metformin therapy should be considered in those with pre-diabetes, especially those who are overweight, those who are aged 60 years, and women with prior gestation diabetes. So persons could ask, how can I prevent diabetes? Well, if you are overweight, metformin. If you are over 60, take metformin. And if you have a history of gestation diabetes, take metformin. Now, metformin has side effects and so on, but we'll only know if you take it. And we recommend that prediabetes is screened for modifiable risk factors and cardiovascular disease, which is what we do. And we have a whole raft of medication. This is not a pharmacology lecture. We won't get into this. Just to remind you that the armamentarium in the hands of the doctor is vast. If you don't respond to one, you put you on another, and another, and another, until you get to target. If you fail to respond to at least 3, he's going to have to put you on insulin. And the key point I want to leave with you, colleagues, is that it's pointless for you to stay on medication when you're not responding, because the root cause of diabetes is insulin resistant and impaired insulin production. So if the doctor puts you on oral agent, sulfonylureas, meglitinides, second generation agents, and all the others that are available, if you're not responding, then you need to go on insulin. And it is pointless to wait until you develop the complications when the damage has already been done to go to insulin. With respect to insulin, there are many types available: rapid acting, short acting, intermediate acting, and long acting. Your doctor will choose the right one for you. And just to remind you that with respect to insulin, regular insulin peaks quickly and drops quickly. NPH or lente rises by 6 hours and drops by 18. The basal insulin gives you basal insulin for the whole day, but you have to add regular or insulin is for in order to deal with meal intake. Your doctor will discuss that with you. So I'm going to wrap up now by reminding you that in order to control diabetes and prevent it, you have to assume responsibility for yourself. We call it diabetes self-care. You need to recognize that the doctor is a facilitator, and you basically are the chief player in this process, and you have to assume responsibility for your health. Therefore, you need to recognize that you need to achieve and maintain body weight goals. You need to achieve appropriate sugar, blood pressure, and lipid goals to prevent the complication of diabetes. It is pointless for you to be on medication and you're not at under 7, under 11, and under 6.5. I want those numbers to remain in your mind because they're easy. If you're not attaining those numbers, it means that you and your doctor are wasting time, and you need to come in and let us talk so that we can prevent you from ending up with all the complications I just mentioned. I'm not going to discuss nutrition. Dr. Callender will discuss that. But just to remind you that you need to focus on physical activity, which essentially, if you're pre-diabetic, should be 60 minutes of exercise or more per day. And if you have type 2 diabetes, 150 minutes or more of moderate vigorous activity per week. It's useful to do some resistance exercise to help your muscles to grow and to prevent atrophy or loss of muscle mass. This one is kind of a no-brainer. You need to decrease the amount of time spent in daily sedentary activity. And of course, flexibility training and balance training are recommended for those with diabetes. And the recommendations, and I'm sure Dr. Prasad will elaborate on that, is seriously into yoga and meditation and so on, walking, yoga, vigorous outdoor gardening, swimming and dancing. For example, I am particularly fond of soca, like when I was on campus, still do. Put in a soca, work up a sweat, and you're good to go. Of course, you must actually stop smoking if you smoke. With respect to psychosocial issues, and I'm sure Dr. Prasad will discuss that, a lot of persons with diabetes are just stressed out, and they are suffering from what is called diabetes distress. I think I like the term. They are depressed, they're anxious, they do not know what to eat, and they develop some kind of mental problems. Therefore, Dr. Prasad will elaborate on that, I'm sure, as how to overcome diabetes distress. And of course, you have to be routinely monitored. We tend not to do that as doctors, really. Patients come in, we give them treatment and send them away, not recognizing that they're not looking particularly happy. And in fact, the distress that they're experiencing might be why they're not taking the medication. You should screen your patients for anxiety and depression and for abnormal eating disorder, which Dr. Callender will talk about. And of course, some person becomes so distraught that they develop psychosis subsequently and need to be referred to a mental health provider. Thank you very much, colleagues, for affording me the opportunity to share my thoughts with you. I hope that the take-home points have been well received and that we will not, in the future, have to see the dialysis unit at the DH running over time because of persons who have developed complications of diabetes, which I maintain is unnecessary and should be avoided. Thank you very much for affording me this opportunity, and I hand you back over to the moderator.
Dr. Bailey, thank you so very much. Very well explained. You've made us all feel very, very fearful, and you've pointed to some issues where we know that those persons with diabetes perhaps have not been behaving themselves in terms of what they're supposed to be eating, etc. I know that even though you gave a very excellent and well-explained presentation, some persons might want to ask some questions, but I ask if you could just wait, keep your questions, jot them down until after the third presentations, and we'll entertain some questions. I thank you very much, Dr. Bailey. Please stay online because we'd love to have you in case there are any questions. Thank you so very much. And now we're going to ask Dr. Joy Callender to join us. Now she's going to let us know what we can eat and what we cannot eat. You know, I think over the years when more food has become available, that's where you see the trend in the diabetes in the situation where we just eat too much. But Dr. Callender will give her perspective and her instructions. Thank you so much. Please continue, ma'am. Dr. Callender? You're not on. Please unmute yourself. We're not hearing you, Dr. Callender. Moderator, can you unmute her, please?
I think you should be able to hear me now.
Yes, thank you.
Okay? Okay.
Yes.
Right.
Hi, Dr. Callender. This is Lion Jennifer. Just indicate when you need me to change the slide, please.
Oh, okay. I'm using your presentation. Okay, fine. Ready. That's just a little preamble. November, as always, the focus is on diabetes. So congrats to the Lions Club for highlighting and their feature on diabetes. So I was asked to speak on the dietary management of diabetes. What can we eat? Next slide, please. So the most important thing when you've been diagnosed with diabetes is to achieve a normal blood sugar. As Professor Bailey said just now, the complications of unmanaged or uncontrolled diabetes are endless. So we want to make sure that we do everything within our power. And that usually means healthy eating, exercise, medication if needed. But it's not just about your blood sugar. Your cholesterol, your triglycerides, what we call the blood lipids, those are also very important. They also have an impact on your blood vessels. Blood pressure is very important. I call them the 3 bedfellows. If you have one, try not to get the second. If you have 2, try not to get the third, because the risk to cardiovascular health and complications increases exponentially. So for type 1, the most important thing is to ensure that you're timing your eating and exercise along with physical activity. We don't want you to get lows, which is much more common in people who are taking insulin as part of their treatment. And for persons with type 2, weight. 70–80% of persons diagnosed with type 2 diabetes are in fact overweight. It bears out pretty much with what Professor Al Bailey just pointed out. And our women are particularly at risk always. And the track between overweight and obesity and blood sugar is clear. What we do know is that losing a little bit of weight absolutely helps with the management of type 2 diabetes. Next slide, please. So how do we determine what your weight is? This is the formula that we use, and it's your weight in pounds. You can do it while you're sitting. I don't know how many of you are good at long division, but you're allowed to use a calculator. We're not grading you. So it's your weight in pounds times this factor of 703. Divided by your height in inches, divided by your height in inches again. And that number that you get is what we call your body mass index, or BMI. So it's a number and it has a specific meaning. The factor of 703 is just to convert the units from metric to pounds and inches, which some people are more familiar with. Next slide. So when you've got your BMI, next slide, please. So when you've got your BMI on the left, there are some ranges for your BMI numbers. And when you look on the right, that gives you an idea as to whether that BMI is good or not so good. So if you're under 19, we say you're underweight. That's no good either. Ideally, we want you to be anywhere from 18.5 to 24.9. That's the normal range. And by normal, we mean that your risk for morbidity, for illness, is at its lowest. So that's where you want to be. By the time you get to your BMI of 25, you're getting to the overweight category. You get to a BMI of 30, you're getting into the obese category. And by the time you get to, so we have classes, class 1, class 2, and by the time you get to 40, chances are you really are in trouble. You absolutely need to do something about your weight. Next slide. You may find this even easier. So if you know what your weight is in pounds, that's along the x-axis. If you know what your height is in inches, then where they intersect. So let's say you're 5'3". So if we go along, let's say you have a height of 150, that puts you in this overweight category. And it's as simple as that. Yeah. So while sitting part of the webinar, you can determine where you are, whether you're underweight, a healthy weight, overweight, or obese. Next slide, please. So we're getting now to this business of eating and what it means and what you can eat. We pay close attention to the carbohydrate foods. That's what that means. So foods with carbohydrates through a process of digestion and so on, they break down to glucose, or what we call sugar. And so that's the blood sugar that we measure in the blood. Then the hormone insulin comes in, produce insulin, and this glucose we want to get to your cells. That's how you get the energy to comb your hair, walk, jump. Your brain needs glucose. So that's the importance of the carbohydrate foods. They're all gonna break down to sugar, some more slowly than others. Next slide, please. A meal plan is ideally what you want. And if you think you can do it on your own, get as much information as you can, but make sure you're getting reliable information. So the person with diabetes is at the center. We have to take into consideration what the person's family situation is. Are they cooking for themselves? Are they buying meals? What can they afford? There's no point telling people to eat fancy vegetables that they can't buy, don't like. So your cultural eating habits, all of these things are taken into account. Next slide, please. So it's very important that you have carbohydrate foods with lots of fiber. And the reason is in that digestion process that we looked at earlier, when there's a lot of fiber and there's complex carbohydrate, it breaks down slowly, so you don't get such a rapid spike in your blood sugar. So this is where we talk about whole grains, whole wheat bread, and eat yam and sweet potato rather than, the more refined foods such as white bread and white flour dumplings and so on. I think portion size is also important though. And I just want to say, somebody made the point about eating too much. And I want to say that very often we eat healthy foods. Sometimes we just eat too much. And that tends to happen when we don't have regular intervals between our meals. We don't have structured eating. We wait until we're starving, then we grab what we can, and then we tend to make poor decisions. Next slide, please. These are the food groups that we use in the Caribbean, and so it's what we use in Jamaica. And so you see it's foods that we know. It's the yam, it's plantain, it's sweet potato, it's mackerel, it's chicken. If you choose to be vegan, then you can go with things like tofu and TVP, veggie mince and these things. Fruits, vegetables, we're familiar with those. So callaloo is okay. You can still get a bundle of callaloo, so you don't have to, and try to buy in season. This way you help to contain your costs. And especially during this COVID period, many people have found therapy in growing some of their own, particularly vegetables in their backyard gardens. So you're always encouraged to do that. Legumes, I call that the underutilized food group, peas and beans. We complain a lot about how expensive foods are, and they are. When we look and see what oxtail and these things cost, very high. But we get not only carbohydrate foods from our peas and beans, we also get protein foods. So it's nicely balanced and cheap, usually. And of course, fats and oils. Not all fats are good, but we do require some healthy fats. Next slide, please. Let me say that those food groups, they're the same food groups that our children or Jamaica for things like the same food groups. So here are the food groups, and this is Jamaica. The Ministry of Health came up with this in 2015, and it's meant to give us a guide, some general guidelines. Notice the presence of water rather than the sodas and the juices and so on. Sweeping, so you're meant to see activity, but there are the food groups. Now we can argue as to the percentage of the different food groups that we ought to have, and that can vary depending on your stage in life. If you're not running and playing a lot, then perhaps you don't need as much carbs as somebody else who is physically active mowing the lawn, but they are the same food groups. So there's your breadfruit and your crackers and your ripe banana and all of those things. Next slide, please. And this in words is pretty much what I've been saying. We want to eat from all of the food groups. Always be wary of any diet that tells you that you shouldn't have foods from a particular food group. We want fruits, but you've got to be very careful with fruits. Fruits are carbohydrate foods, so they are going to break down to sugar. So what we have to do is manage portion. And the thing that helps tremendously is if you combine fruits with a little, well, hardly, not usually protein, but something like nuts, which is healthy fats. So that helps to balance your blood sugar very nicely. Vegetables, that one we usually can't get too much of. Again, our peas and beans and nuts, reduce salty and processed foods, fats, the sugary drinks. I mean, that message has gone out for a very long time, and we should be aware of it. And of course, physical activity. As a nutritionist, I talk about food, but I can never, ever help talking about the energy expenditure, how we burn the calories that we take in as food. Next slide, please. So in general, we want to eat less fat. Most people, we say that Jamaica is fried chicken country. It's one of our favorite things. So we want to reduce that sort of deep fried foods and have some more healthy fats, things like nuts and seeds and avocado, pear, and that sort of thing. Next slide. I like pictures, and so it just makes things a little bit clearer. We tend to have too much. It really should be sodium, but of course, salt is one of the most prevalent sources of sodium. So we want to utilize our seasonings and our condiments rather than just relying so much on salt. Next slide, please. And of course, the sugars. Sugar is just a concentrated source of carbohydrate. So we don't want to, there's so much sugar in things like pies and cakes and all of these kinds of things, the sodas. So we get enough from the carbohydrate or fruit in portion, things like coconut water and so on. Next slide, please. So in general, what we want to do is, if you can think of this not necessarily as a plate for each meal, but in terms of what you do for the day. So we're not big on Thanksgiving, we're becoming more so. Now with COVID, I'm not sure exactly what happens, but Christmas is coming. So there's a business of a lot of food. Make sure that you start out with lots of veggies, cooked, raw. You are allowed to use a bit of salad dressing. You need some protein foods. So that's whether it's chicken, fish, mackerel, those things. And then we want to have our healthy carbs. Remember, I've been talking about carbs with fiber. Okay. And we want fruit, but as again, I said, in portion. Next slide, please. What's a healthy Jamaican diet? It's a balanced diet, as I said, incorporating all of the food groups with regular consumption of lean protein sources, healthy and essential fats, vegetables, and complex high fiber carbohydrates. And those are larger carbohydrate foods, the fruits, the ground provisions, the whole grains, and or legumes. Next slide, please. I just wanted to give you an idea that you can, in fact, eat some of the things that Jamaicans eat. So you can eat rice and peas. Yes, you can. But notice that you want to make sure that you've got your vegetables. You want to make sure that you've got your protein. Next slide, please. Somebody who is more physically active might have, so this is meant to be sweet potato. So it's more carbs. Your protein is there and lots of vegetables cooked and raw, just to give you a sense of what a meal might look like. Next slide, please. I'm not sure if I skipped one, but anyway. So in terms, there's no specific diabetic diet or diet for diabetes. It's the same foods that we're accustomed to eating or ought to be eating. What we need to do is make sure that we manage portions. especially the carbohydrate foods, and how we combine those carbohydrate foods. So as far as possible, we want to have it with either some protein or, as I said, some healthy fats. And a registered nutritionist or dietitian, this is our purpose. So if you need help, then you seek help. There's never a sparsity of advice when it comes to diet. And I use the word diet simply to mean whatever it is that you eat. You may be on a weight loss diet or whatever, but you need help if it is that you need to lose some weight, or if it is that you need some help in managing your blood sugar and so on. So there are always specific goals, and we come up with an eating plan bearing those things in mind. Next slide, please. So in terms of management, it's always a team approach. You always have your GP, that's the person who monitors everything that you do, sends you to the specialist. You might see when you've just been diagnosed, maybe you need to see an endocrinologist or a diabetes specialist, an ophthalmologist, make sure there are no issues with the eyes, and so on and so on. And a clinic ought to have, depending on the level of the clinic, these specialized areas. Your pharmacist is very important. That's a person who will guide you if it is that you're on medication, the dosage, what you should and should not have with it, what will cause low blood sugars and not. It's not all cough medicines and so on that diabetics should take. Your nutritionist and dietitian. And there's somebody called the diabetes educator who gives you even more information covering all of the aspects of your diabetes care. I thought I would just share a little bit. The Diabetes Association offers this, has this Life for a Child program, so that if they are unable to afford things like test strips, which are very expensive, they can get free glucose meter, insulin, and other supplies. The National Health Fund, amazing. So you, through your doctor, through your GP, you can apply for a free glucose meter, and lots of your medication and so on are subsidized. I just thought I would share 2 websites with you, 2 reputable websites from which you will get good information to help you with the management of your diabetes. Next slide, please. So in summary, there's no one specific diabetic diet. Eat a balanced, healthy diet with a variety of foods, paying attention to portion control, maintain a healthy weight, participate in regular physical activity. And next slide, please. But that's it from me. Thank you very much.
Oh, Dr. Callender, this was so informative. Thank you so very, very much.
You're most welcome.
It tells us that if we behave ourselves, maintain our weight, and just eat the right foods, we should be okay.
Absolutely.
But unfortunately, it seems as if the more access we have to food is the more that we tend to eat, you know?
But you know, once we understand, it makes such a difference.
Such a difference, yes.
And a lot of people are fearful because the concern is that all the things that they like are going to be taken away from them.
Indeed.
And so they approach diabetes with fear instead of empowerment.
Yes, yes. Thank you so very much. And we're going to ask you to just stay behind a little bit, just in case anybody have any questions for you. After Dr. Prasad's presentation, we are going to entertain some questions. I hope we will have the time. Dr. Haim, are you there, sir?
I am here because I'm here.
Yes, yes. We are happy to have you. You may start your presentation.
All right, I'm going to ask the person to share the screen. There are 2 slides or 2 what you call documentation that I sent. But in the meantime, whilst that is being set up, I must say thank you.
Dr. Haim, please let me know which one to start with.
The first one is in managing my personal management of diabetes. That one comes first before the 10 steps. So while this is going on, I must say that I'm very pleased to have heard Dr. Bailey's frightening lecture I said frightening, and he did mention it's really the complications, which are really frightening, you know, that got me as a medical doctor, as a human being, to be where I am today, free from diabetes, totally cured. So my gratitude is number one, to God, to being alive. Number two, my gratitude to the Lions Club of St. Andrew and my brethren, Lions, and all associates and friends. And my gratitude to all the teachers and the patients who inspired me to share what I am about to share. So in the first slide, while that is going on, I proceed if I can get it. If not, I have a copy in my, it's coming very good. No, it's the other one. So as the next one comes on, you'll see. That's right. So this is the one, the background. There are a number of pointers. First thing is that I must say, it's by the grace of God that I actually got this miraculous phenomena, because I was eating 5 mangoes, despite the fact that Dr. Joy Calendar came at a presentation that I had on my A Renewed View in 2000. I didn't really scoff at what she says, but she said to me, "Doctor, the amount of fruit should be just 1 slice of the mango." At that time, I was eating 3 mangoes. So I refused in some way, because not refused, but when the mango is sweet, and by God's grace, when they fall to your ground, my culture, and something fall to your feet, it is like the good Lord's blessing. So I take a little knife and I chop off the little back spots, and I go ahead and yum, yum off the mangoes, and happen to be 3 East Indian and 2 Julie. So background, the symptoms came on: PPPDB, polyuria, that is pissing, passing a lot of urine; polydipsia, thirst, plenty thirst, drinking water, and polyphagia, feeling hungry every minute. And so, and the dizziness and vomiting came on. So I got frightened. So that was what happened in 2011, really. 2015 was a mistake. So it's 2011 that the symptoms came on. The blood sugar values at that time was 12.6, which is 228. So according to Professor Bailey's measurements or numbers, anything over 200, that's it, you're a diabetic. Not a question of pre-diabetes, you're a diabetic. And then my colleagues, the professors and others, they said, okay, Haim, since you have a strong family history of diabetes, you have to be on treatment. So I was put on medication to bring down the sugar. And my A1C, which is a marker of diabetes and proper control, is 7 maximum at that time. But now the figure is 5.7. It's a percentage. So my colleagues, and as well as myself, we are justified to put on medication, because my mother, there were 8 sisters and 4 brothers. Every single one of them died from diabetes by age 60, 61, except for 2. One of my uncles, he was a parson, a reverend in the Methodist Church, and he lived up to 78. And my aunt, whose daughter is in Jamaica, she lived up to nearly 80 years, and she was a gardener, a farmer. She was exercising and planting her callaloo, etc. Number 4, good reasoning. The family history I mentioned, and the value is high. Number 5, frightening, 2 myths, which Dr. Bailey, amongst all the medical colleagues, you have to be on drugs for the rest of your life. That was riveted in my brain out of my 40 years of medical practice and graduation. And so it frightened the daylights out of me. Perhaps patients, we have to think that patients are like us. We as doctors think that they don't have any feeling and they have to this and that. But when the feeling hits you and you realize out of knowledge that you have to be on drugs for the rest of your life, dog, yam your supper. And you have to be on time, you have to take your medication, you have to follow your diet. According to Dr. Calendar, I followed it as best as I could, but couldn't budget except when I started taking medication, came down, but I got pregnant. So very soon, the second myth is will sooner than later have complications, damage to my eyes, damage to the kidneys, damage to your legs. My mother died from a complication called gangrene of her foot. And so it was quite devastating. At age 60, I saw her suffer, and I started thinking about myself suffering. So these two myths have been actually removed by further down you would see it from the people who advised me. So my weight was going up when I started medication in 2011. By 2015, I got pregnant, six months pregnant. I went up to 158 pounds. My pants were getting a bit tight. I had to buy a new belt, etc. So 2011 to 2015, due to treating the medication. I wasn't treating Dr. Prasad. I wasn't treating me. I was treating the medications. The tablet was bringing the sugar down, and so it made me feel hungry. So I went through 2 cruises, my goodly wife and family. We thought it would be a good idea to take some cruises and relax and eat healthy and so on. So I ate healthy, of course, healthier than healthy, because the medication was helping me to feel hungry. On the middle of the night, I will go to the fridge or will take something to the room and I have my little snack, etc. So this abundance of food assisted me greatly to get that pregnancy state. Now I'm about 3 months pregnant. I'm struggling with my exercises. We can go up a little bit now with the tape, the slide. So looking for help, the videos by Dr. Jason Fung, Sarah Hallberg, Brian Mowell, they showed me the way. And the main person, Jason Fung, mentioned something I share with you, is that the more you treat, the more insulin you give, is the fatter the patient becomes. And the weight is difficult to control because insulin helps to control the sugar, but it helps to increase obesity. One of the biggest things is insulin resistance. And the more you eat, the more resistance you get. And with the help of the insulin, you're actually reducing, getting sugar under control, but you're still not dealing with the issue, which I'll come to. So not in numbers, we should not treat the numbers. As a result, by changing this from 2 slices of whole wheat bread to 1, along with a piece of cheese or a boiled egg in the morning, my result changed in 2 months. In 1 day, it started going down from 12.6 to 10. And I said, you son of a bitch, I got you. You know, and every day I checked my sugar 2 hours after the breakfast. Started at 12.6 and it reached to 4 in 2 months, which is 72 milligrams %. I felt dizzy, sweaty, abdominal pains, features of hypoglycemia. So I immediately stopped the medication and kept on my small carb diet. 6 years now, I'm still alive. I'm on no more anti-diabetic medication. It is no more since 6 years ago. The blood sugar is maintained at 5.5 in the morning and 2 hours after about 5.5 as well. And my HbA1c is at 6.3 at the moment. It had gone down to 5.7, but out of a little delinquency from time to time, you know, it steps up. So it's not easy, but I'm not needing any medication. Am I healed or what? At age 78, heading to 79, Lion, my brother, Lion Isaac McCullough, he's my idol because I see him as a healthy man. You all know him. And he is, I would say, over 80, and I'm 78. And I said, well, if Isaac can reach this age and look so damn healthy and very minimal thing, and not a diabetic, what am I to worry about? I have no fear at all. So I feel like 15, 7, and 8. I have lost 14 pounds from the 158 to 144. And I maintained this over the past 6 years. No longer wake up to go to the fridge. If I wake up in the night, I drink some water, because I know that I will not die from hypoglycemia due to medication. So the fear of medication is a hell of a thing. Fear of waking up and finding myself dead is my greatest fear. I don't want to wake up and find myself dead. I want to wake up every morning feeling very happy to treat my patients and my friends. Number 8, two types of causes. What is the real cause? Everybody said, what is the cause, doctor? So there are a number of tapes and videos I see. One is a foodie. That is very important. Those of us who like food, we go to parties, and the other is stress. And I have a very good example, sweet drinks. The first example that I share with you is a 25-year-old young man who was at his honeymoon, and he had 9 bottles of Pepsi Cola, leading to coma. He ended up at the university hospital with a value of 30, which is about 500 milligrams %, was put on insulin and given insulin to go home and take it easy, follow the diet, etc., as best as they advised. And he came to me about 1 or 2 weeks after. He was getting into hypoglycemic situations due to the insulin. And of course, nobody had asked him before. But when I sat and asked him, what do you eat? What do you drink? He says, doctor, let me tell you the truth. I was on my honeymoon and I had 9 bottles of Pepsi. I said, Jesus, well, no wonder. That volume of sugar that you put in the system made a reaction, and the sugar level went high, and it was misinterpreted to be a state of diabetes or permanent diabetes. So that one has been totally healed, no more treatment, and all the fear and distress that he had in his mind was totally removed by maintaining a healthy diet. And he's a healthy young man. He eats twice as much as what I eat, but he has twice as much energy and activity. Number 2, the stress precipitating overweight. I have lots of patients and friends who are very overweight. And when I ask them the problem, they say, well, you know, it started. You know, I had a beautiful weight when I was pregnant for the first time. At age 20, 25, I was 130, 140. Now I'm 240. I said, but what caused it? You know, it said over the past 2 years, I've had family problem, and that's when the diabetes was found. I had family problem, somebody died in the family, my husband was having prostate cancer, etc., and I was under high stress. And so that stress precipitated that insulin resistance and even more weight. So sleepless nights can cause the weight to go up, over concern for relatives and their illnesses. So by obedience with the diet, as Dr. Callender outlined, which is absolutely beautiful, that is what you call a classic. It's really not a specific, you know, cut and dry type of thing. If you can vary it, small portion of starch, choosing the right one. So by obedience to the diet and exercise, transformation occurred. And number 9, the 10 steps approach, which I will go into detail. So we can go on to number 10. There is hope, evidence-based medicine, change in lifestyle, faith, hope, and charity formula. Evidence-based medicine is what Dr. Bailey mentioned. You have to have your blood pressure, your cholesterol, your weight, etc., checked, and your sugar. So those evidences and other things like kidney function, etc., have to be done if we want to keep the patients well. So I recommend my friends to check up. If you even feel that you're well, once a year, you should have a routine executive profile. Change in lifestyle, faith, hope, and charity formula. Most are stuck in being workaholic, lover of foods, partying in the excess, burying their head in the sand. That is not accepting the conditions to be treated. Tests must be done to give confidence. That is, if pancreatic failure, they will have to be on insulin or other medication. I was actually very concerned about this. And I did see there's a lady named Adele Davis who had a topic, which is eat to live, or eat well, live well. That was written in 1930, 1940. And she made a very strong point that you can actually reverse pancreatic failure by means of magnesium, vitamin C twice a day, and of course, eating healthy. So, and it was a strange case where the person had a prostatic problem, and he actually reversed not only the insulin-dependent diabetes, which he was beginning to depend on, but he reversed his condition totally. He was healed out of his diabetic state. And the strange thing is that his prostatic tumor disappeared. His prostatitis, you know, was part of the inflammation, and that I will mention. Somebody had asked a question about omega-3 fatty acids. So can we go on to the next slide now, the next sheet of instruction? 11 great motivation points. I added this: education, book. If you look at your inner mind, you think carefully, education is what Dr. Prasad or my fellow colleagues and so on have done. We must be educated as to what is the cause of diabetes and what is going on wrong. The book, the diet, you look at an apple, so you can draw a picture somewhere for those of you interested. Number 3, exercise. You have a running shoes, monitoring a graph, and medication, syringe, and needle. Until we find a cure, we must take control. So these 5 pictures must be riveted in our mind, because treating diabetes is not simply going to the doctor and the doctor takes charge and he does a test and he gives you medication and you're trying your best. But you have to have these 5 points. So I encourage patients to write down their values and try to follow the diet. So we can go on to the next slide now. So here are the 10 points, and this wouldn't take long. Screening patients for diabetes, this is what we do at health fairs, can be very revealing. During the COVID-19 pandemic, you have the added burden of seeing patients who are established diabetics. That is, their resistance can go down, and their ability, their manifestation of a pre-diabetes to type 2 diabetes are being manifested, and they have weak immunity, history of frequent coughs, colds. So there's a twisty, twirly situation. It's called a vicious circle. The higher the sugar level is, the more difficult infections are. Use an example. If a person has a bad foot, a septic foot, the doctor has to not only increase the amount of insulin to bring down the sugar, but we have to treat it with antibiotics or treat the infection properly. And that goes for coughs and colds. If you don't treat the coughs and colds early or infections, the sugar will go up. And low hemoglobin, low white blood count, loss of weight, all of these are factors that we have to bear in mind in the COVID season. So what I'm about to reveal to you now are 10 points that will improve immunity. And I did this whole series, this critical page, I share it with my patients and friends. It has all the essence on how to get rid of COVID or to be above COVID. Apart from the vaccine, you'll notice that all of these 10 points have a hell of a lot of benefit to the body. Number 1, the meals must be on time. We're dealing with the diabetes. Avoiding food whilst working hard can create a high steroid or stressful state in the body to create overweight, leading to severe stresses on the joints, even when off your feet, and severe stomach ulcers. The first meal in the morning must be within the hour. That is very important. A good friend of mine, a family friend, Dr. Chad Rowana, people from the Diabetes Association met him. His father was a nutrition expert, and he himself is teaching nurses and so on in Canada. And he says that it has been found scientifically that if you have a meal, the first meal you should have after you wake up is within the first hour. I find a lot of our Jamaican diabetics, they are very hardworking people. They are running like a horse. They wake up at 4 or 5, they do a little devotion, they don't eat, they work like a horse until 10, 11 o'clock in the morning. Then they have their breakfast. Now that is a no-no. It must be within the first hour. So immunity goes down due to sustained stress, pains, lack of sleep, and infections. Number 2, reduce starch. Small amounts, this is alluded to, but I outlined it very simply, quickly. Small amounts of rice, flour, Irish potato. I come from a tradition, the East Indian or culture is plenty of rice, plenty of roti, and plenty aloo or Irish potato. High glycemic foods can be changed to yam. It's not that we're going to stop eating these things, by the way, like our rice and peas. Jamaican man is not going to stop that. His flour dumpling is not going to stop, but the quantity has to be reduced. So it can be changed to yam, boiled bananas, sweet potatoes, breadfruit, dasheen, eddos, or cocoa, cassava. These are preferred. These are all fibrous. They're slowly absorbed. Juices, including coconut water, can give a quick rise of sugar, which can be dangerous and must be avoided. I had an interesting patient at the Diabetes Association about a year ago. She was floundering around. The sugar wasn't coming down despite all the best treatment. And I gave the little pep talk that I give to the patient. And she said, hold on a minute, doctor. I normally drink 8 glasses of coconut water per day. That's why the damn sugar not coming down. I thought that drinking plenty coconut water is good for the good for the sugar, good for the heart. So we should remember for the apple, for us, the daily apple per day is permitted. I permit my patient to use 1 fruit each day, and that will keep the doctor away. For 1 glass of coconut water per day, the rest must be water, or if possible, all water. Excess starch inflicts pains. Diabetes symptoms, hyperglycemic states create a lot of pains. It may not be a neuropathy. It may be purely pain due to the excess sugar that actually cause not only infection, but it causes the muscles and the tissues to have a pain reaction, which is called a lactic acid breakdown, both connected to reducing immunity. So excess starch inflicts pains and reduce immunity. Number 3, can go up a little bit more, yes. Now, reduce protein. I put this here because, as Dr. Calendar, Joy Calendar did indicate, particularly for a hardworking person, you can take your 2 pieces of chicken. But if you are a normal or diabetic patient whose sugar is high and who is overweight, I suggest reducing the protein. If you're a vegan, half a cup of dal, which is split peas, or chana, chickpeas, at each meal is sufficient. 1 egg or 1 piece of chicken, or 2 tablespoons of meat, which is curry goat or curry, half of a slice of fish, half of a cup of milk is considered to be a meal plan or a protein plan per meal. Too much leads to gout. I had a Trinidadian friend, young lady who did life sciences, who had gout due to taking 1 cup of chana, which is equivalent to all the day's quantity of protein, and she took 3 times the amount. And it was causing her toes to get very swollen and her knees to pain. So I have some vivid example. So too much leads to gout, damage to the kidney and joints. Too little or no protein leads to malnutrition or reduced immunity. Number 4, drink 7 to 8 glasses of water. Avoid juices. 1 fruit per day is good. Plenty of vegetables, raw or steamed or boiled. Green juices are excellent. Of course, you don't put in too many fruits in it, or avoid fruits. And you can use yogurt to make it blend very nicely. So 4-ounce fruit juice per day is permitted instead of a small fruit. So if you want to go juice, it has to be small. All right, so too little water can lead to dehydration and unresponsive infections. So watch out for that. When I was having the COVID in March of this year, a good friend of mine, my daughter's good friend, said she had to overcome the COVID by drinking plenty of water, because the hydration is very important to help to lubricate the lungs. Apart from getting the oxygen, we need to make sure that adequate water will help to permeate the lungs and so on. And I thought that was excellent advice, because in my meditative state, I didn't feel thirsty, but I insisted on drinking 1 glass of water or 8 ounces every 2 hours. Number 5, exercise. 15 to 30 minutes daily, aerobic and strength exercise. So not only jumping up and down and moving your body, strength, Dr. Joy Calendar referred to this, the muscle strength is important. The muscle has a lot to do. Using a muscle and burning up the excess sugar is important. So I use 2 10-pound weight when the rain is falling and I can't go in the garden. Simply walking nonstop for 10 to 15 minutes daily or gardening can perform miracles. Enjoy the exercise without a rush. Smile at nature or yourself in the mirror, giving thanks to God. Strengthen your muscles. Diabetes and sugar level are reduced to the advantage of those who obey the rules, but immunity is reduced for those who don't. Next, up. Number 6, 7 to 8 hours of good sleep will provide restoration, recovery of all body systems. I find that if I don't sleep, my sugar would go up. But having learned the lessons, I find that I sleep well. Even if I get 6 hours of sleep, I find my values still keeping good. Healing of the pancreas and joints, apart from the brain, heart, kidneys, and nerves. So these, the sleep has a lot to do with everything, including our memory. So lack of 8 hours restorative sleep can reduce healing and immunity. I find a lot of my patients and people generally, they are on the screen and keep me up late at nights. and they're excited by all of the beautiful things that they could see and all the jokes, etc. But what is happening is it's affecting them and affecting memory and causing a lot of problems. Number 7, pains. If possible, use safe analgesics instead of steroids or NSAIDs like Panadol or Tylenol and so on. Acetaminophen, they are safer. And there are other high-powered ones which don't affect the stomach. But steroids or NSAIDs, generally, you have to be very careful. I always advise a stomach protection for those who have to be on those strong pain relievers. Vice versa, excess sugar levels in the blood cause temporary pains. However, if not controlled effectively and sustained long, can lead to permanent neuropathy. So the high sugar levels create this permanent or difficult pains that doctors have to treat and reverse. And out of my personal experience, even pains, even kidney damage that is mentioned can be reversed. Dr. Jason Fung, he is a diabetologist and a nephrologist in Canada, and he had a number of patients who were on insulin who are totally taken off of insulin. These are type 2 patients, just purely by dietary changes and proper exercises and following the guidelines of proper sleep can reverse and remove all the danger. People who have had vision problem, macular degeneration, and as I said, kidney damage, who were on dialysis, were taken off the dialysis very quickly, and their eyes got rectified very quickly. Now, these are not anecdotal stories. These are real, true-to-life stories and demonstrated through the various videos that I will share with others. Number 8, infections must be dealt with. Worms. One of the common problems that many people have may be as simple as worms that cause them to have restless nights. A lot of my patients say, my God, I didn't take a worm treatment since I was a child, you know? And so worms, when we eat fruits and vegetables, it can cause small microscopic little entry of worms. Dental problems, respiratory problems, genitourinary problems, skin and nail problems, to name a few. Note well, all infection increase the blood sugar level. If not treated properly and early, will get worse and reduce immunity. I had a patient referred to me by my good friend who was the person who looked after the podiatrist, and she had her toe, the bones were eaten out. The x-ray showed that she had lytic lesion or destruction of her bone in her toe. And out of my personal treatment of treating the pain, treating the infection, improving the circulation, getting the sugar under control, getting her rest, she was on her feet for 12 to 16 hours per day. I had to advise her, and she completely reversed that problem within 1 month. Her foot was healed. She never stopped praising me for that. So if you're not treated properly and early, it will get worse and reduce immunity. So any infection, may as simple as scratches in between the toes, doctors are advised to ask the patient to take off their socks, take off their shoes, and have a look at the toes. I've seen quite a few patients recently who had no complaints, but the toes were all flea-eaten, moth-eaten, badly damaged looking, and starting to have gangrenous changes. But they didn't realize, they didn't think that it was necessary, but that's the beginning of the end, and they can lose a foot out of that. Number 9, reduce all unnecessary stress, financial, work, health, relationship, anxiety, depression. These stresses can cause serious blood sugar elevation. So identify these. It can be done by repeating the last 4 lines of the Lord's Prayer. For thine is the kingdom, the power and the glory, forever and ever. Amen. In meditation, spiritual guidance, we can identify them and learn to release whatever is our mental focus. A lot of people have inside problems that they're not discussing. They can't even tell the doctor. All they need to do is to talk to God, in my advice to them. So in meditation and spiritual guidance, for thine is the kingdom, Lord, you can deal with my money problems. The power and the glory, Lord, you can guide me how to be well. And may you guide the doctor to take his time with me. Forever and ever, the Christ within me sees the Christ. I see goodness in everybody, including the various miserable people that we have to deal with. And amen means I let go and let God. Number 10, let go and let God. Put the Almighty first. Chill out. Come away from incessant work, commitments, stresses incurred from self or circumstances, planning for our peace of mind, worship, prayers, music, dances, smiling, laughter, yoga exercises, meditation can all assist. Find a method that will bring you joy, bring us joy. So these are real immune boosters. Anyone who chooses to be superior or inferior to his or her humanity is heading for disaster. Ultimately, the body benefits from peace. All parts are benefited: the brain, the heart, the endocrine, and stomach system, to name a few. And before I say the last line, one of the tail twisting jokes, because of our fellow lions, the fellow and his wife, they both died and they're in heaven. Apparently they had an accident. And whilst they're playing golf, they enjoy golf together. And, all of a sudden, he flung down the golf club and he tramped on it and he started to get angry. So she says, the wife says, why the heck you getting angry? You're in heaven, you're enjoying yourself. Why are you making life difficult? And he turns to her and says, are you? What do you mean by are you? He said, you with them damn diet and exercise and meditation and all them things that keep me live so long. We could have died long before and reached this kingdom of heaven. so it was like a joke on the situation, a reverse joke, that despite all that is being said, we of course wish to live long. We of course wish to live happily. We of course want to reverse. When I tell patients, this is with or without the doctor's intervention or confusion and friction, I tell them, well, practically you can do it. You are type 2 diabetic, and I go into this horrendous inquiry to find out whether they're eating right, they're exercising regularly, and most important, are you worried about money, etc., etc. And believe it or not, they all come away peaceful, and I've had some great responses and people who follow. It's not easy to follow the advice. And the last quotation, live your best life. You may have whatever kind of life you want. If you decide what kind of life you want and then say no to everything else. And I end with, may we all be blessed by our efforts and God's grace. I thank God for the Lions Club. I thank God for the efforts by everyone. And I thank God for the fact that our eyes are opened by the doctors who presented today. Dr. Alverson Daly gave a very clear picture of what faces us. Can we do something about it? Can we make life happy for everybody? It's entirely up to us. Can we? Should we? Must we? I see Lion Keris smiling. I thank you all for coming together. And any questions? I know we might have had some restriction of time, and that restriction of time,
Yes, Dr. Haim, you took away the time with your joke, so you hold the club. With the treasurer, please take $1,000 from Dr. Haim for the joke at the end of his thing. Dr. Haim, it was certainly a pleasure. You gave us some personal information plus some professional. And it seems all the three presentations spoke to us about self-inflicted situations that could well be prevented. And this is what one of the things that we must take away from the three presentations tonight. Land President, do we have time for any questions based on our schedule?
We have time for a few questions.
Would you like to monitor that for me, since you have the control with the hands up?
Yes,
and so?
I see a couple that posted from Dr. Bailey's presentation.
Yes.
I see Wilbert Williams' hand is up. Wilbert Williams.
Lan Wilbert, go ahead.
Yes, can you hear me?
Sure.
Yeah.
Yes.
This is for Dr. Bailey. You did make a comment about metformin, but at the point of your comment, the reception was very poor. Can you please repeat that comment if you can recall it?
Okay, thank you very much, sir. First, let me congratulate my colleague and mentor, Dr. Prasad, for excellent and well thought out presentation, which actually emphasized that the primary role of the patient is essentially to take control of his or her life.
Indeed.
And
Yeah.
to ensure that they control their food intake, modify their thought processes, and take good care of themselves. So the mainstay of diabetes management is essentially lifestyle modification. For years, experts have been trying to see if there's any medication that can assist with lifestyle modification. Now, as Dr. Prasad mentioned, if one can avoid medication, it's best to do so. However, we do know that some patients need some assistance. Despite their best efforts, sometimes they need help. And metformin has been shown to, it's called a biguanide, and it actually helps to decrease insulin resistance. And interestingly, it also suppresses your appetite. So it is actually an additive to the lifestyle modification that Dr. Prasad had mentioned. It does seem to also help to stabilize the cells in the pancreas, which are called beta cells, that is responsible for production of insulin. It seemed to stabilize the beta cells and prevent what is called in physiology beta cell exhaustion, where if the beta cells are overworked, after a while they actually become tired and they become exhausted. And in fact, the changes that takes place in the pancreas is actually very similar to the changes that take place as a result of Alzheimer. Some proteinaceous material get deposited in the pancreas called amyloid, and so the beta cells are changed and become useless. So apparently, metformin does seem to stabilize beta cells and help to decrease insulin resistance, and it also influences your appetite. So it actually, so many persons who are on metformin, after a while, tend to lose weight because their food intake is reduced. The downside to metformin, though, is that it has a lot of side effects. It can cause nausea, abdominal pain, and it can also affect your B12 levels. So if you're taking metformin, you have to be advised of the risk involved, the possible side effects, and the impact it might have on your vitamin levels. And so it has to be taken with caution. But sometimes, despite the patient's best effort at lifestyle, they might find it challenging to control their diabetes. And so metformin is recommended, but it is not the first line. It is actually the second line drug.
Okay. Thanks, Dr. Bailey. I think I have two more questions for you and then one for Dr. Calendar. This question is, can diabetics take omega-3 supplement or also because zinc? I think that's it.
Well, I think Dr. Prasad had mentioned that in fact, if you talk about zinc in terms of one of the, let me rephrase my statement. One of the concerns I've had with the way COVID is being managed is failure to recognize that diabetes, as Dr. Prasad mentioned, is a condition which has a serious effect on your immune system. In fact, diabetics are essentially immunocompromised, which is why they are so prone to infections and they end up with a lot of other complications. What has been shown clearly is that vitamin C, zinc, and vitamin D3 does help to boost your immune system, especially, interestingly, zinc, which has been shown to have a fairly profound effect on improving your immune defenses. So because diabetics are essentially immunocompromised, I would therefore recommend that they consider taking zinc. And interestingly too, with respect to vitamin supplements, vitamin D3 has been shown to also be fairly useful for persons with impaired immune system. And a lot of you might perhaps ask, so we are in a tropical environment, and so we are getting a lot of sunlight, which helps to produce vitamin D3. But some persons are so pigmented that it actually prevents the sun from being absorbed. And so they've actually shown a lot of studies, that a lot of blacks, in fact, do have vitamin D deficiency. And so they end up with osteoporosis, and also they end up with weak immune system. So vitamin D3 supplement is useful for diabetics, and also vitamin C to help to boost the immune system and prevent infection. Omega-3 fatty acid does help to improve your circulatory system and has a good effect on your platelet. So yes, I would recommend it, as Dr. Prasad had suggested.
Okay, thank you very much. And the next question was whether there has been any research to try and understand why is there a high level of obesity and diabetes in women over men in Jamaica.
I think that's easy to explain. The data is clear that overweight and obesity is much higher in women than in men. And it speaks to the lifestyle of men. Men, as a rule, tend to be more physically active, and they tend to be involved in work-related duties that it requires a lot of exertion. So men, as a rule, tend to have a higher metabolic rate, and they tend to be more active, and so they tend to burn more calories. And so women traditionally are involved in occupations that are sedentary, and so there's reduction in their exercise output. Of course, women also, because of their hormonal milieu, which is primarily estrogen and progesterone, tend to accumulate subcutaneous fat, and they tend to store fat more easily than men. Our testosterone enables us to burn more energy. And so you find that because men are more physical and they're more energetic, their energy expenditure is greater. And so therefore they tend to be less likely to store fat than women who are more sedentary. And also because women as a rule tend to store fat, especially because of your hormonal environment. So it means therefore that if you're going to target obesity, we really need to find ways in which we can encourage our women to really get more physically active, to burn off the extra calories that they're retaining. I don't think it has to do with food, because as a rule, men tend to consume more food than women, but they tend to burn it off faster.
Okay. As Dr. Haim said that we consume more dumpling and some of those big what we call manly food. So I totally understand what you're saying. Dr. Calendar, there was one question wanting to clarify what exactly we classify as processed foods. And the question also went on to say, was sausage, bacon, etc. included in there? So if you want to help us out there a little bit. I think you're muted.
She's muted.
Jennifer,
Okay.
There you go.
Good.
So sausage and bacon are processed foods. We talk about whole foods. If your food goes from the ground into your pot, then that's very little processing. So you tend to find that those foods have more nutrients. The nutrients which are in food, the micronutrients, the minerals, they're all very important in ways that we sometimes don't understand. So if you have an Irish potato and you boil it, you have an Irish potato. If you cut it in smaller pieces and you deep fry it, so you make fries, which of course is a hit with everybody. And of course you add salt. What's fries without salt? And you then have a processed food, what we call an ultra processed food. Now, it doesn't mean that all processing is bad. Let me explain that. For instance, sardines and tuna, they're canned, so they're processed. But I very often say to people, I don't see any sardines swimming in well, I don't go to Pedro Keys, but I don't think we have any in our waters. But they're fish, they're oily fish, they're a great source of omega-3 and healthy fats. And so to me, that processing is absolutely worth it. If you have issues such as hypertension and renal patients, where it really is critical to lower and manage your sodium intake, then you can actually get canned sardines, and it will say no salt added, or it will say low sodium. In fact, tuna, you can actually get very low sodium, so that, for instance, patients with kidney impairment and so on may need to go to that level. So in general, we want as much unprocessed foods as possible, but unless you're going into the whole business of just eating raw foods, then some of your food will be processed. For instance, many people don't realize that carrots, the carotenoids are actually more bioavailable, meaning we absorb them better when they're cooked. So to answer, in general, whatever we can have as much unprocessed as possible, it's better. But there are circumstances when it's fair enough to have processed food, depending on the
Okay.
process.
And I assume that there are some that we'll call extra processed food. Those are the ones that require all these additives and preservatives
Exactly.
to last longer. So
Exactly.
okay.
But again, if I might say, if I recommend a bread to somebody that has no preservative, which is what we want to avoid those additives as much as possible. But one, you have to keep it in the fridge. Most things on the shelf have additives in it. They have preservatives in it. So life is about balance, whatever works for you. If you can use the bread that's kept in the cooler and you keep it in your fridge, you toast it, warm it when you're ready for it, then sure, that's fine. I mean, if you think about it, bread is processed. Bread is not the same bread that was in the Bible, unleavened bread, when it was stone ground and so on. So it's always about balance. You do the best that you can and you make the best choices that you can, and especially depending on your goals.
Okay. Thank you. And Dr. Haim, I remember a presentation you did over in Arnett Gardens, and you could not stand before the crowd and say, "Don't eat bread." So you said eat one slice. Don't eat two.
Indeed.
And I clearly remember that conversation with the crowd, and I was a little bit fearful if you were gonna say, "Don't eat rice and don't eat bread," because then everybody would be, "What can I eat?" So
Yeah.
I'm happy that we are able to find that balance there.
Okay.
Dr. Haim, you're muted. No, you're still muted, not hearing you.
Yes, I have a sort of serious situation facing me, because a normal Jamaican man or woman comes into my office with 2 yam, 2 dumpling, and 2 banana for breakfast with ackee and saltfish. And I got to tell them that they can take only 1 out of that 6. And in their mind, they said, "Me not come back."
They're not coming back.
Not come back.
and they will do that, you know, they won't come
Indeed.
back. Not giving them the right message.
Right. So I accept your method of saying dial it down a little bit. I mean, we can still have it, but take a little at a time. Dr. Calendar, I think there was one person that wanted a little bit of a reminder on the BMI calculation, that math.
Right. If I can just give you a little bit, when I used to do a lot of radio programs many years back, I remember a caller calling in and said, I was talking about sardines and the benefit of sardines. And he said, "Oh, you telling people to eat deaders." You can't please everybody. Work with everybody from where they are. So the body mass index calculation. So it's your weight in pounds, and you multiply that by a factor of 703. And whatever you get, you divide by your height in inches, and you divide by your height in inches again.
Oh, so you divide twice, not
Twice.
The height squared. Yeah.
Oh, okay.
Yeah. Okay.
And so you end up with this number. And that's your BMI.
Okay, all right, got it. I
Okay.
think
That's it?
that's most of the questions we had. I mean,
Okay.
there
Sorry,
is
thank
one question. Let me try and read this last one, Dr. Paulette. Well, it's a comment that there needs to be appropriate education of effective exercise for women considering cortisol and other hormones in women over 40 or in menopausal phase. I am not sure I get the comment, but maybe Dr. Bailey or Dr. Haim can help us out there. I think it's really increasing awareness around the effect of cortisol and hormones for ladies
Yes,
going on
that-
to menopause.
Middle age spread.
Right.
That is a multifaceted question, and the answer is on, again, my 5 fingers. NEURO. Your nutrition must be okay, because they do have certain products or certain items, Dr. Calendar would know, that do have some estrogenic effect and so on. But healthy green vegetables, etc., are quite helpful. Nutrition. E for exercise. U for undue stress. My biggest area of concern is that a lot of steroids, a lot of cortisol, a lot of adrenaline, a lot of that sort of thing can affect the system. And R is rest, again, the sleep, your 8-hour sleep. And the biggest success of all is O, optimize your cerebral function. Find a purpose in life. Congratulations, Lions Club, we serve. Find a purpose in life. When we help others, we are helping ourselves. So that's my answer to that question there.
All right, back to you now.
Right.
Yeah, thanks, Dr. Haim. Back to you now, moderator. And before you take back, I just want to say, I knew you had the magic. We got up to 111 attendees.
Okay, yes, it was really a pleasure. And I'm thankful for being given the opportunity to work with these 3 fine professionals this evening, Dr. Alveston Bailey, Dr. Joy Calendar, and Dr. Haim Prasad. We are a little over time, but I'm sure it was well worth it based on the information that we got, good information, which tells us now that we must control ourselves, control our diet, control our lifestyle, right? And so that we can stay away from the amount of meds or get rid of it altogether. Thank you so very much. Land President, I turn back over to you.
Thanks, Land Dr. Paulette, for that excellent way you moderated. And again, you would have said thanks to the presenters. I mean, we really had a multinational audience here. I saw North America, I saw Eastern Caribbean. Naturally, we have Jamaica, and Northern Caribbean was also represented. At this time, and thanks for the indulgence, we are just about 25 minutes over. I now hand over to Lion Isaac McCullough, Progressive Melvin Jones Fellow, to give us the vote of thanks.
Thank you, Lion President. I assume you can all hear me clearly?
Yes.
Yes.
I think we should have presentations at this point. If you'll check the program.
Not my program, but yes, go ahead.
Well, we do have some, right, there you go.
Right, okay.
So if you will take charge of that, please.
Okay, to our esteemed presenters, starting with Dr. Bailey, I present to you the certificate of appreciation on behalf of Lions Club of Zone 4 for your excellent presentation. I mean, it was filled with information that, based on the comments and feedback from the audience, was well received. And so on behalf of the club, I present to you the certificate of appreciation.
Thank you very much, sir.
All right, and we'll make some arrangements. I think we'll give it to you virtually as well as physically. Next up, Dr. Joy, it was a pleasure having you. And I mean, I take away that it's all about balance. And so we'll go away saying that to try and keep balance in life. But thank you very much for your presentation and your math formula, which I've noted right here. And I'd go home now and try and calculate everybody's BMI in the house. So
You're most welcome.
thank you very much. And we did enjoy, and naturally we are a lot brighter for having had you here and hearing your presentation. On behalf of the club, please accept the certificate on our behalf.
I do. Thank you.
All right,
Well appreciated.
great. And
And Dr.
last but not least, Dr. Paulette, should we give this one, since he gave us such trouble with the joke, but because of his miraculous recovery.
Yes, yes, yes.
Dr. Him,
I owed it. I owed
Yes,
the club
maybe we
$1,000.
reduce the fine.
we reduce the fine.
Yes,
But
indeed.
thank you very much for your presentation and your testimony. And I think it gives us a lot of hope. And those of us who are on the borderline are there in pre-diabetic stage, we know that there are a lot of things that we can do without having to think about a pill or an injection each day. So
Yeah.
thank you very much. And on behalf of the club, we want to present to you the certificate of appreciation.
You're welcome.
All right, thank you. My apologies, Lion Isaac. Back to you now for the vote of thanks.
Thank you, Lion. President, in this particular evening, you are not our first vice president, you are our president.
For president.
Filling in admirably for our absent, unfortunately so, Lion President. Lion President, Lion Zone 4 chairperson, other distinguished Lions, audience, guests, my fellow Lions. I'm very happy to be asked to move the vote of thanks this evening. And I need to begin by stating that in my personal opinion of the webinars and other meetings that I have attended on the subject of diabetes, as you know, the Lions Club have been working with diabetes for so many years. We are almost rivaling our reputation for sight that we have with sight in terms of the work we're doing with diabetes. This webinar this evening is, in my view, by far the best that I have attended. And I wonder, as I will allude to later on, if there was any collaboration between the presenters, because they fell so very nicely together,
Yes.
as I will mention later on. I want to start off by, first of all, thanking our first Vice President, Lion Horace, who so ably presented himself this evening as our president at this very important meeting, webinar. Also, I'd like to thank Lion Andrea for giving us the Lion's Prayer. Lion Blondie Scott, my very good friend from Spanish Town, for doing the code of ethics for us so ably. Thank Lion Zone Chairperson, beg your pardon, for your remarks this evening, and happy to have you. I understand that this was a zone project in a way, and so your contribution was well received. I want to thank the Lion Paula, who is the District Diabetes Associate Chairperson. Well, was she here this evening? I'm trying to recall if she presented this evening.
No, she didn't make it.
Didn't make it.
She did, but she couldn't stay.
You
But
couldn't-
she didn't get to give remarks, but she sent her.
I thought I'd seen her, yes. So I want to thank her for attending anyway.
She had a power cut.
Oh dear, yes. Unfortunately, well, I'm going to suggest midway here that I know that the webinar was recorded. And this was such a worthwhile activity that I'm going to suggest that we we save this recording so that we can play it later on, because this information that we got this evening cannot
Priceless.
get old and will always serve a very worthwhile purpose. Thank Sharon Wilson for introducing our moderator. Thank you. And of course, what can I say? Our moderator, par excellence. Did I pronounce that correctly? Like Dr. Paulette?
You
Very
did well, Lion Isaac.
Very well done. Thank you very much.
Thank you.
We get on to the presenters. Dr. Bailey, I know when I sat back and looked at the statistics that you presented this evening, I was frightened out of my wits. I do agree with one statement you keep on making, we're just not doing enough. There's an old saying in Jamaica, you know, that when things get hard, Jamaican women get fat. I wonder if there is any relationship to the experience that we're having with statistics. But it doesn't augur well for what we're doing, and it actually is going to be a red flag for us, identifying that we have to up our game to try and cover some of these grounds. Thank you very much for your frightening statistics, which brought us all awake and alive. Dr. Callender, consultant nutritionist. Perhaps your presentation made me the most happy, because I was delighted to hear that my favorite foods, which include stew peas, broad beans, and callaloo and saltfish, were among those regarded as healthy in the correct proportions.
Yes, you
I'm
can.
delighted to hear that I'm on the right track. Thank you very much for that reassurance. Dr. Prasad came with a cure. What else could we ask? The statistics are there. The methodology presented in terms of nutrition. Dr. Haim presented his personal experience with his professional advice as to what we can do, not only to affect the advance of this terrible condition, but to cure it if we have it. I was particularly interested in the experience he related about the person who was cured from the dialysis procedure. That I'm sure would be regarded as some kind of a miracle. And of course, the miracle is our self-discipline, because a lot of us know what we should be doing and what we should not be doing. But we don't take it too seriously until we get into trouble, particularly in the area of COVID prevention. So thank you, the trio of presenters this evening, for doing such a fantastic job, and that we were able to record it so that we can use it down the road and in the future when we're talking to persons who were not fortunate enough to join us this evening. We mustn't forget our IT team who put together our presentation this evening so admirably. Thank you very much, IT team. And what would this webinar be without the attendees? For all those persons who made the time to be with us this evening, thank you very much for coming. And I personally hope that you got as much out of this webinar as I did. Thank you very much, and walk good, and keep healthy, and drink a lot of water. Thank you very much.
Thanks for that wonderful vote of thanks, Lion Isaac. And yes, we will drink water. Sometimes we will add a little thing here and there, a little spirit here and there, but we will stick to water, right? Just to add that despite our best efforts, we have been trying to allow our hardworking president to rest, but she couldn't miss the session for anything in this world. So I know she's present somewhere. Lion President Denise, welcome. And we are now on to item 12 of the agenda, which is announcements. Any announcements? I am not seeing Line Secretary Line Keris. Do you have any announcement?
Not at the, no land chair, so sorry.
Okay. Dr. Paul, none either, right? I don't see.
Oh, sorry.
Um,
sorry,
Horace.
Line
Well,
Horace.
Line Horace.
Oh, I think line president is gonna.
Line President?
Yes, we have our interclubbing activity this Saturday,
Oh, yes.
November 27th. So we'll
And-
share the details. It's a
Okay.
cookout.
Okay.
Yes.
Okay, no problem. Looking forward to it. I thought it was a dance, but I'll take the cookout nonetheless.
It's a
No-
cookout with all the Lions Club in Zone 4A.
Okay, and considering that what we just heard from Dr. Calendar, I'm sure we need to adjust some of those recipes.
Oh no,
Right.
we are way ahead of the game.
Oh, there you go, there you go.
Recipes
All right.
are in line with
Okay.
Diabetes Month. All the
Okay.
nutrition, everything is there. Yes.
All right, no problem. So Dr. Emma can eat, so I don't get into trouble, right? So we have that. Line Keris, you had another announcement?
No,
Okay.
no land president. I was thinking of the same cookout.
The same cookout. All
Yes.
right.
Line President, talking about cookout, the Ligony Preparatory School is having their Christmas fish fry and barbecue. We sent it to the club and we've gotten 1 or 2 orders so far, but I have a captive audience of 100. So I have 100 fish and chicken available on the
Available.
3rd. On the
Okay.
3rd.
On
Only $1,500.
That's December 3rd, right?
December 3rd. Yes, yes.
And orders placed through you.
Yes, please. Yes, yes.
Okay.
So I can write down 100 orders. That would be fantastic.
All right. Thank you very much.
Land fair, I think the Lions Club of Mona also have barbecue and fish fry. Anyone from Mona who want to tell us? I think it's this Friday.
Sure, some Mona lines.
Someone,
Yes, you're correct, Line Keris.
Right.
The lunch sale is on Friday. We have, I think, three options, and those go with 3 different prices. I don't have them at hand at this time, but those would be circulated if it is that we can get additional meals. We're looking for, that is, additional persons to purchase meals. We're looking for a target of 500. I think we're close to 300 or so. So we're trying our best. Thank you so much. And I can get that shared in the zone group through the Land President.
Okay. Thanks, Lion.
I'm chair to the chair. I'm Lion Charming Mills, president of the Portmore Lions Club, and we too are having our annual barbecue this Friday as well. It's a curbside pickup barbecue. We have lunch hour and dinner hour.
And where is your curbside, Lion Charming?
At the Lions Den.
Okay. All right. Great. All right, so that's 2 events on the 26th. That's Mona and Portmore barbecue, both on the 26th, if my calendar is telling me right. And then on the 27th, it's the cookout. And on the 3rd, it's the Ligony Club event. Am I?
Not Ligony Club, Ligony Prep.
Prep, sorry. You know why I call it Ligony Club, but that's all right. Ligony Prep.
I go.
All right, so yes, so I think I summarized all the announcements. So please do support where you can. So we have two. If we can split the purse on Friday, let's do. And on the 27th, there is a plan for a grand cookout. And on the 3rd, we have fish and chicken at Ligony Prep. So
you don't need to split the purse there at all.
By that time, it's all the Christmas bonus that we're spending right there, right? Right. So
Line Horace. Can you hear me?
Hold on 1 second, Line Pres. I think I hear Line Blondell.
Blondell, yeah.
I'm just checking. Check with me, please.
Okay.
Off air.
Oh, okay, no problem. I call it right after this live, London. Line President,
Line-
you're saying
yes,
something?
Line Horace, line Zone 4B Chairperson, Line Avaloy, her hand is up.
Oh, sorry. My apologies, Line Overloy. Go ahead.
Thank you, Line Chair. Just want to use this opportunity to announce a few things from Zone 4B clubs. On the 26th of November between 11 a.m. and 2 p.m., Lions Club of Kingston will be having their Friday pickup brunch at the Lions Center at 30 Beechwood Avenue, Kingston 5. And the cost is $2,000, comes with barbecue chicken or jerk pork or escabeche fish, served with rice and peas, sauteed pen pasta, and steamed vegetables. For information, I'll forward the flyer to Lion Kerris so that she could also pass it on to your club. They also have a speakers night on December 3rd, that's Lions Club of Kingston. Sorry, December 1, my bad, at 7 p.m. And their guest speaker is Dr. Lucian Jones. He's the Vice Chairman of the National Road Safety Council. The topic will be on road safety. And on Saturday, there's a mini health fair, a diabetes mini health fair. I think the organizers are Downtown Kingston, Heart Foundation, and UTEC Nutrition and Dietitian Society on the 27th at the St. Matthew's Anglican Church. I think it starts at 9:30. So those are a few of the happenings that we would like for you to also attend if you can. Thank you.
Noted. And let me see if I get it there. It says a pickup brunch on Friday the 26th, 11 to 2. And then there is the speakers evening with, I think it's Dr. Lucian Jones. And that's on road safety. And on the 27th, there will be a diabetes health fair.
Mini health fair, yes.
Fair, right.
At the St. Matthew's Anglican Church.
Anglican Church. Okay. Thank you very much.
Thank you
All right.
too.
All right. Any other announcement? Nope. All right. So we have now come to the end of the evening's proceedings. So we are now at adjournment. And I think I see Lion Rosie around the place, and she's usually first off the bat when we say adjournment. So
I so move, Lion Horace. Thank you.
okay, on cue, Lion Rosie, thank you very much. And seconded by Lion Andrea. So thank you very much. All right. Have a good evening now, everyone.
Have a safe evening, everyone, and please be safe.
Good night.
Bye. Bye-bye.
Bye. So good to see you all.
Bye all.